experts, followed by an interactive panel discussion. It is interactive, so please do not hesitate to enter questions into the chat box. Answers will be given in the panel discussion or as part of the Q&A download document that will be made available after each day. In addition, you will have the chance to listen to deep dive 60 minutes lectures on all topics in on-demand webinars. These will be made available to you on this platform right after the live session. I remind you that most lectures will be in English, some other in French, and all will be available in English, French, and German through subtitles. The panel discussions will be in English. For all sessions, you can earn CE credits. Just answer the little quiz we provide for each session and webinar. Yesterday, we started with exciting lecture and highly interesting discussions on digital dentistry, what's real, what's next. If you missed it, just check out the on-demand section of this site. There, you will find also the 60 minutes in-depth webinars of yesterday's lectures. Today, we will address the topic digital procedures in fixed and removable prosthetics. You all know how tooth loss can affect the quality of life of patients. We are starting out with two lectures by well-known experts in the field. First, August Bruguera from Spain, followed by a team lecture of Dr. Alessio Casucci and Alessandro Lelasi from Italy. I'm very pleased to introduce August Bruguera because he's a very, very well-known dental technician who has inspired uncountable technicians through this work, and his teaching is part of the International Bioemulation Group and is the craftsman par excellence who takes this mastership now to the digital world. Please, August, tell us about your digital world.
Hello, how are you? It's a big pleasure to be here today. I want to say thanks to Ivoclar Vivadent and Jean-Pierre Attal for this nice introduction. It's a very good initiative. Cannot be celebrated in Paris, and I think it's very, very good. Okay, my lecture from brushing to design. I want to explain you why I think that is interesting to change from the analog side to digital side, because I am analog man. I am absolutely an analog man, that I am changing to the digital side. But the question is why? Why I need change, no? Because, I'm not a young man. If I think I don't need change. I can rest in my analog side without problems. But if I did that, I will betray my students, because always I told them that the present is what we have to learn and the future is what we have to invent. For this reason, I think I need change. I need to learn the digital side. But it's very curious, no? Because if you talk about us, the analog people, the analog people always will say the analog side is better. It's better because have more quality. It's with the heart, because we are craftsmen. But if you ask it to the digital people, the answer will be, my friends, the digital quality is enough. You don't need more. And the production is absolutely more. Absolutely. But I think that the answer is in the market. The answer will have the market. Who is better? If it's true that the digital quality is enough or not? This is a good question. I will try to give you an answer in my 1-hour presentation. But today we have two different products, yes, because we have the layering product with my hands and the milling product by the industry, by the machines, a monolithic restoration. And are two different products for us and for the patient. When you see one layering veneer or when you see one layering stain technique veneer, you feel absolutely different. But if you have a single center like these 3 cases that you have here, my friends, always to have match, you need layering. It's not possible by stain technique because half match is not easier. It's difficult, and you need a lot of control about the color and the colors layer, But if you need to make 4 veneers, or you need to make 6 veneers, or full arc rehabilitation, in this type of cases, you have always 2 ways. You have milling way or layering way with your hands, yes? And always you will have different possibilities. But possible, you are analog man, 100% analog man. What do? You will do crowns, veneers, and bridges. Imagine that you are half to half, yes? You are half analog, half digital. What do? The same, crown, veneers, bridges. No, I am full digital. What do? Exactly the same. Crowns, veneers, and bridges. Always is the same. Only change the way, not the product. Our patients will receive the same product, but the way changes everything. In my hour presentation, I will show you 2 incredible experiences. The first experience is I send the same cases to 3 different dental technicians. One analog with layering technique, other one analog with press technique, Express, another one with a full digital technique, yes, by a milling machine. And you can see the results, and you can see other thing, very interesting thing, the expensive. What is more expensive? The digital or the analog? This is something interesting too. And the other one case that I sent to other 3 different dental technicians, but in this time was 3 digital dental technicians, and they sent me 3 different results, absolutely different. And in the lecture, I will show you why I think that we have big difference between these 3 dental technicians. But the question is, when I am analog and I make a wax up with my hands, drop by drop, I think always that I put a drop, I am thinking about composition, I am thinking about shape, proportion, in size of triangles, The question is, when the digital people, when you make a digital design in your computer, in what moment you are thinking about the shape, about the volume, about the insides of triangles? Where? When? On theory, when you choose the library, you are thinking about everything. But I think this is not true, because possible in your computer you have 200 different libraries. Possible, yes? And you think about all libraries, about the shape, volume, etc. Or you choose the library because in this moment you like a lot of this library shape. This is a good question. I think that if you choose the library thinking only only because you like this library shape is a big mistake. Because when you need make the design, you will have big problems, because you will need stretch the mesh, and you will need shrink the mesh. And if you stretch the mesh, the milling machine will work fine. For this reason, it's very, very important that when you choose the library, have different criteria in your mind. Sorry, my English is very, very, very bad. Okay, I want to show you in our lecture what you need to think in the moment that you choose the library. Thank you very much. Yes, I will be waiting you in our lecture.
Thank you very much. Thank you very much, August, for this very, very nice lecture. And now, once more time, I present you one dentist and one dental technician. Dr. Alessio Casucci and Alessandro Lelasi can certainly be considered as a top team of dentists and dental technicians experts in removable prosthetics, with in-depth knowledge about all the do's and don'ts in this challenging area of dentistry. They are now exploring how to go to digital world, taking all their knowledge and experience to another level. Alessio and Alessandro, it's your turn. It's up to you now. Please show us what you call the removable metamorphosis.
Hello everyone. Thanks Professor Attal for your kind presentation. First of all, we would like to thank Ivoclar Vivadent for inviting us to this prestigious meeting. Unfortunately, we cannot meet in Paris as planned, but it is still a great privilege to share with you our first experience in the digital world. Here is a video to start.
Metamorphosis means to change and how we can approach to the future.
We are not digital native in dentistry. We still work with analogical protocols. However, we also need to learn to adapt, even if it's not easy and it takes time and effort. We asked if we are ready for the future, because it's coming now.
We learn in the laboratory how to manage digital work.
Also, in the clinical practice, we have seen the effectiveness of this approach. The aim of our work is to improve the quality of life of our patients.
This is the most important metamorphosis.
So, in this brief presentation, we are going to talk about our edentulous patients and how we can approach their treatment with the digital protocols. These patients need to be restored for functional, aesthetic, and phonetic aspect but they also need to be rehabilitated for their social activities and their self-esteem. So our work is to improve their functional performances, restoring their mouth, but also their dignity. We approach to these patients solution with different rehabilitation in our daily life, but in this case we are going to talk about the removal solution, and in particular our digital protocol. We started our metamorphosis since a long time because we still worked with the closed mouth protocol in the analogic concept, and we moved to the digital protocols very easily because of that. During the last months, we also approached to the intraoral scanning, and now we are using to send the information to the laboratory, just scanning our impression or the copy of our prosthesis. Maybe during time, in the next months or in the next years, we are going to register the impression also with the digital scanning. We are testing it in the dentulus, mandible, and maxilla, and now we are using very efficiently in the immediate denture.
In laboratory, we are moving from the traditional denture to the oversized digital denture promoted since 2017, up to evolution that we present for the first time in Europe. Of course, in the future, there will be many other news.
So, what about protocols? The protocols for the digital approach are really close to the conventional one in the clinical aspect. We can reduce the number of appointments as we have done with the closed mouth technique, and also we can improve the quality of our rehabilitation using the gnatometer and evaluating the neutral zone, as we are going to see in the next case. So we approached the digital world after evaluating the evidence. The evidence in literature is going stronger in the last years. So we have seen how the accuracy and the fit of this prosthesis is very interesting, as well as the patient outcomes. Patients are really satisfied with this denture, and also retention and stability of this prosthesis can be really improved. Regarding materials property, we can see that about the monomer and also the fracture resistance of this prosthesis, the results are very, very interesting. About the clinical standardization, we have seen with students and in our courses how is improving the quality of the denture, also when the participant or the practitioners are really new to the denture and their experience is very reduced. Relating to cost, we can say that we are going to see also in the next presentation how we can reduce time consuming of this rehabilitation. So is a very interesting way to proceed in the digital world. Here you can see our first patients that we treated with the digital protocols. He was treated with an immediate denture before, and he was a very severe periodontal patient, and so he lost everything. We are going to discuss this case and the other case in the next on-demand presentation. And we treated these patients for the first time with the digital protocol. The starting point is the same to the conventional approach. So we take the conventional impression with PVS material. In this case, we use virtual putty consistencies and the light one. After that, thanks to the centric tray, we can register a preliminary intermaxillar relation that is very useful for Alessandro to obtain the individual trays. With this device and also applying to this device the 3 3D UTS CAD facial ball, we can analyze the occlusal plan, and we can compare to the bipupillar line and to the camper plane. So I received from Alessandro this individual trace. He is going to give you a lot of detail about these procedures in the next presentation. And I register with them the closed mouth impression. So you can see here the detail of the tissue, how we can activate the muscles during this functional impression. And also you can see the gnatometer device that is very useful to check the occlusal relationship.
When we have scanned the models, the first step is to check the occlusal plane. In this case, we are going to use the registration obtained by the clinician on the frontal side and on the lateral side. We check also the anatomic reference point on the models. On the lower jaw, we must define the pound area. Once we have analyzed the model, we go on and define the peripheral rim. The software allows to preserve it through the displaying in section. This is what we usually do during the boxing phase. We analyze the undercuts. As for the analogic, we reduce the wrinkles area. At this point, we choose the artificial teeth. The software suggests an initial positioning following the marked reference point. Matching the occlusal rim, we can see if the teeth are assembled in the right position, and if not, we can move them. Each arch is independent and can be moved. Each tooth can be moved and put in the best position. Once we have finished positioning the teeth, we can whether print it and send it to best or finish it.
So I received from Alessandro the try-in, and with this tool I could test the static position of the posterior teeth. This is a very useful way to test the stability of the new denture. It is also easier than in the conventional protocol because we don't have the wax, so the material, the resin material is very, very stable. We evaluate also the cheeks contact. In this case, the contact was very nice, but we had a lack of contact in the posterior area, so we used the PVS AV material to improve the contact in that part. So I asked the patients to have some functional movements, and we fill this part in the new denture. I also evaluate the occlusion, and the occlusion was amazing because we had the same contact that we plan in the software. And also I could test with the patient some food because it is a very nice way to test the function on the new upcoming dentures.
We realize first milling, obtained the plate and the oversized teeth. The plate and the teeth are bonded, and after this step, put them in the milling machine PM7 again. The prosthetics are refined, polished, and sent to Alessio.
So finally, I could deliver the new denture. Our patient was really satisfied about aesthetic, phonetic, and also function after testing it. And he asked us to have new dentures. For sure, he needs a second denture just in case he lost or he had problem during time. So we decide to obtain the new denture with the new concept in the digital world, that is Evotion. Evotion is related to the concept of Evotion is related to the shape of the disc. The shell shape is provided from the industry and allow us to obtain the majority of the arches in terms of dimension.
As Alessio said before, and who has seen our work now that we put a lot of passion in the rehabilitation of edentulous patients. So we try to take care of our proposals in the smallest details, individualizing teeth and the pink part. Our attention goes above all to the search for the function. This can certainly be obtained in digital, which can represent the future of the removable prosthesis, as it's already present in the fixed prosthesis. What we show today is our first approach to this new world, which can, of course, be a useful method to reduce the time and expectation of our rehabilitation. Ivoclar Vivadent has greatly simplified the digital denture manufacturing process over the years. Today we can use a rapid and reliable monolithic process to create aesthetic and quality prosthesis.
So I could receive the new Evotion prosthesis from Alessandro and I delivered to our patient. The patient was really satisfied about phonetic, aesthetic and the gait function. The retention of this prosthesis was really interesting and the accuracy of the base is very, very improved. So he decided to wait to receive implants because of this great result with the new dentures. Before finishing, I would like to show you briefly this case. We are going to discuss it in the next on-demand presentation. This patient was treated with the complete denture realized in the digital protocols, and with this very easy way to proceed, we can really improve the quality of life of this young patient. So concluding, our removable metamorphosis allow us to simplify our procedure and our protocols. We can communicate in a better way from each other because I'm living in Tuscany and Alessandro is in Ischia. And also we can communicate very efficiently with the patients, as we are going to see in the next presentation. Time cost efficiency is also another very important point, and we are going to discuss again. And the improve of the quality of life of our patient is the main aim that we have in our rehabilitation. So before concluding, I would like to thank, a special thanks goes to Marco, to Diego, to Laboratorio Accioli Puccini, to Claudio and Edgar for helping us in this project, and a great thank you goes also to Ivoclar Vivadent for involving us in this extraordinary experience. For sure, we would like to thank you for your kind attention. We wait you in the next on-demand presentation and see you again.
experts, followed by an interactive discussion.
Is
Our project
going to this link go
I can understand, no? Because if you think about the cost, and if you think about some countries, possible would be very, very difficult, no, to invest money in a digital system. But I think for small labs, digital is something very important because the productivity is more than the analog side. If you need to make single crowns or posterior restorations by digital way, is something very fast, something very easy for you. Of course, it's very expensive, but always is the same, no? If you need mill chrome cobalt, this is something very expensive because you need a lot of time to mill chrome cobalt. Possible is better for a small labs is they send to a big company, externally company, to mill it. But if you mill zirconia, if you mill lithium disilicate, feldspathic or composite materials, to have a small machine for you in your lab is something perfect. And yes, it's expensive, but your production will help you to pay it without problems.
Thank you. Alessio, in the dental office, do you save time and cost for the patient in digital world?
Yes, sure. I think that this is the big question because we need to improve the quality of our rehabilitation. We need to standardize the rehabilitation that we are producing for our patients, and also we need to contain costs and in terms of time and money for our patients, because we know that everywhere the economical condition can be changed. Also, if we look at the last problems with the virus, maybe the future in economics can be changed. So I think that digital devices in general and procedures can improve and can standardize our procedures and can reduce costs for patients at the end.
Thank you. Alessandro, as a dental technician, you agree with Auguste? You save time, you have a good productivity with digital technology?
Yes, I personally don't have a milling machine. So at the moment, I use for this moment two type of a disc. With this Evotion disc, we obtain the final result in only 2 hours and a half. Okay, in only one cycle of milling.
Okay, thank you. You tell us about the Evotion, but maybe you can tell us if it is already available. We can buy this product at this moment.
Yes.
It is on the market. It is on the market, Alessio. Evotion.
Yes. I think it depends on the different part of the world, but we tested a few months ago, and I think that at the end of June is available in the rest of the countries.
Thank you. Auguste, you tell us about the library. On what basis should we choose one library over another?
This is a very good question, because to choose a library is something very important. Because if you make a workshop drop by drop, you are thinking about the shape, about the volume, about the proportions drop by drop, I put one drop thinking about the shape. I put one drop thinking about the volume. I put another one
thinking about the proportion. But when you choose a library, you choose everything in just one moment. When you choose a library, you choose the shape, the volume, and the proportions. And possible you have inside your software, possible you have 200 libraries. I don't know, 100 libraries, a lot of. It's not possible to look all libraries to look for in these parameters, these aesthetic parameters, okay? For this reason, the people choose the library thinking about, today I like this library, you know? This is a big problem, no? Because after, when you have your library inside the case, you need to adapt the library to the case. And this is not okay, yes? If you think about this, you can understand that when you choose this library because you like the shape of this library, you know? But the most important part of the tooth is the cervical part. Because if you think, when the library shape is looked for in the final preparation, the big deformation is in the cervical part. For this reason, it's very important to choose the library thinking about the cervical part shape, the cervical part proportion, the lack. Yes, because if you have this something similar with the same proportions, your library will have too much deformation when the library look for the final preparation. And this is something very important, because if you have a lot of deformation, after you need to stretch the mesh, you know, and if you stretch the mesh, you are open the triangles and your milling machine don't mill something nice for you. It's very important thing, choose the library thinking about the lack, about the cervical proportion.
And Alessio, is there a library for removable prostheses?
Yeah, sure. We can use different dimension and different shape of teeth. We can combine them, and we have two ways to obtain a removable prosthesis. Mainly, we can use the oversize procedure, and with this procedure, we can use a lot of different type of teeth from the market. And the second one is the version Alessandro mentioned before this procedure. In this case, we need to adapt the teeth that we use in the patients according to the possibilities that we have from the disc, because this kind of disc have a shield shape, and we have to adapt each case in this case. So we can obtain a very individualized prosthesis, a monolithic prosthesis, but we have different kind of teeth that we can use in this solution.
We have many questions from the participants about the comparison between the results in the digital world and the results in the analog world. So for you, Auguste, what do you think about this comparison? And do you have, of course, a preference now? Maybe you can add something.
For me, you know, digital is precision. When I have a full arch rehabilitation, implant full arch rehabilitation, digital is perfect because it's precision, you know. Digital is function, is perfect for the posterior area, the contacts areas, the emergency profile, the feet. This is perfect. Where is, for me, the problem with digital in the static part? When we are talking in the anterior region, for me, until today, it's better layering. Today, until it's better layering. I am sure. Yes, monolithic results, I think, are enough for a lot of patients. I think the monolithic colors are enough for hundreds of patients, yes, but not for me, sorry. I think by layering technique, always you have a plus on top, you know? Yeah, no, this is that I feel.
And one participant wants to have your opinion from a dentist, Alessio. What do you prefer? Analog technology for restorative dentistry or digital technology?
Well, it depends. As August mentioned before, with analogic and with hands, you can achieve a very, very individualized result in the patients. But for example, in removable, we need to have as well in fixed or in restorative, we need to have precision of our prosthesis. So what we have seen with the digital approach is that we can improve a lot the adaptation of the prosthesis to the tissue of our patients, because we don't have any shrinkage, for example, and also the quality of the resin, the PMMA that we use for the base, is really, really high and is increased. So maybe from some functional aspects, if we look, for example, at the contacts that we can plan in the software, in our experience, we found the same contacts in the mouth of our patients. So is something that is very precise, and the accuracy of this system is very, very high.
And August, of course, in digital technology, you have to stain. Which kind of staining system do you use? And do you have an universal one?
Yes, of course. I use Ivoclar, because Ivoclar is a universal technique. No, it's only one stain kit for every materials, and this is something perfect, you know, because you don't need change the system. I use Ivoclar; it's perfect, absolutely. And I love that the bake temperature, because it's a low bake temperature, and this is something nice.
And for removable prosthesis, the comparison between digital world and analogic world, maybe you can add a comment, Alessio or Alessandro?
For me, as a function, we have an excellent adaptability of the bases in occlusion. It's amazing that with a click we can modify a complete assembling or change the orientation of the plane, saving a lot of the time compared to the analogic. About the aesthetic of the teeth during the check of the train, we have the possibility with one click to personalize our assembling. Regarding the pink part, the aesthetic is monolithic. Okay.
Okay, thank you. Maybe we can talk about material now. Auguste, what is for you the most important criterion when choosing a restorative material, and how do you exchange with your dentist for the choice of the material?
Okay, on theory, in my laboratory, a lot of times I decide about the material, okay? And I think it's a good idea that the dental technicians decide about it, because the dental technicians know the materials answers, you know? The other thing is the parameters to choose the best material. And this is something always a critical point, you know? Always is the same, you know? I need a perfect fracture resistance, I need a perfect wear resistance, I need a perfect static result, okay? If you have balance about this, it's perfect. But, you know, you don't have one material that have the 3 points. Because when you talk about fracture resistance, composite is the best, absolutely the best. When you talk about wear, lithium disilicate is the best. But if you think about aesthetic, feldspathic is the best, you know. For this reason, always you need to choose this material or this other one. And it's very interesting thing that imagine one color, a guide color, yes, A2 color, okay? If you think about A2 by composite material, A2 by feldspathic material, A2 by lithium disilicate, A2 by zirconia, the question is, you have the same A2 or you have different A2s, you know? And this is a very interesting question, because you have absolutely 4 answers, 4 different answers for the same color. It's normal, no? Because the density of the material are different. If you take a little composite and you put a few composite on top the enamel, the composite material have an incredible mimetism. It's a mimetic material, you know. But if you compare this mimetic material with lithium disilicate or with the zirconia, you can see that it's absolutely different, no? Always the density is always that the materials have more density. Always the materials looks more opaque, more white. You know, for this reason, if you have a dark color preparation, yes, always I will choose materials with high density. You know, like zirconia or like lithium disilicate. You know, but if I have a nice color preparation, feldspathic or composite material is my first election, you know.
Thank you. And for removal prosthesis, is there a choice of material?
Yes, mainly we have to, as August mentioned before, we need to have some indication in each case. Usually for the base of the prosthesis we use resin, and if we compare resin quality in the analogic world to the digital one, we can appreciate how the new digital resin that we can obtain by milling procedure is very high in fracture resistance, and also in the reduced monomer that is elutable in the mouth of our patients. So from this point, I think that the digital solution can improve a lot the quality of our prosthesis. Regarding teeth, Alessandro and me, we are using still a lot of ceramic in the analogic world, and we are really happy about the use of ceramic. But also we can use composite and the milling materials that we can obtain from the market. For example, the multi-layer material are really interesting also about their resistance to wear, and I think that we can obtain very good results also with that materials.
Yes, we have many questions on zirconia. Auguste, can you perform high aesthetic result with zirconia restorations?
Absolutely, absolutely. And today is easier. Today is easier. When I remember the beginning of the zirconia, was most difficult to have a nice final result than metal ceramic because it was something opaque, you know. Today, the zirconia is something nice because have a nice denting color, have a nice lucency in the inside. So if you see Circat Prime, you can have really translucency in the incisal area. If you put, I don't know, something Opal Effect 1 and you put a little mamelon mass, it's very, very simple to have a nice final result, you know. For me, zirconia is incredible material, but always that you don't have bonding, because if you have a bonding possibility, I prefer lithium disilicate, you know, like framework, you know. But if it's a bridge, in this moment, I prefer zirconia, of course. In the posterior area, monolithic; in the anterior area, layering zirconia.
Thank you, Alessio and Alessandro. In the digital world of removable prosthesis, we have many questions on vertical dimension and occlusion. Maybe you can comment a little because they don't really understand how do you manage.
Yes. The vertical dimension evaluations and also the centric relation recording are two of the big chapters of the removable. So I think that is very important to determine a proper vertical dimension. It can allow our patients to have a comfort with their dentures, and also we can reduce the bone resorption if we use a proper vertical dimension. The technique and the steps that are required to record this aspect maybe are very difficult to resume in a short answer, but mainly with regarding the digital protocol, for example, we started from the first appointment when we registered the preliminary impression. Also, we register a first vertical dimension, and using this registration, we can start to give to the lab the first step, the first aspect for determining the occlusion of our patients. So we can change the vertical dimension in the second appointment, but if we start with a first determination of this aspect, is very helpful for our treatment protocol. And the other aspect is related to the horizontal registration of the intermaxillar relation. We used for a long time the Gothic arch, and also we have found that using that device in the digital protocol is a very useful way to determine the centric relation. So we just apply some of the old concept of the removable prosthesis in a new way, just moving to the digital one. But I think that maybe we need more time to discuss about this very important aspect for prosthodontics in general.
And for impression, is primary impression possible with intraoral scanner?
Yes, it could be possible. There are some protocols and some papers on literature that reported how we can scan the maxilla directly, the tissue directly in the mouth of our patients. Maybe we cannot register the functional activity of the muscles, but we have seen, and there are a lot of literature that report this data, how we can obtain a lot of accuracy in between the tissue and the base of the prosthesis using the intraoral scanning. So maybe if we look at the future perspective of this field, maybe one of the future devices that can be improved, that can be included in this protocol, will be the intraoral scanning.
Definitely. And the secondary impression?
Yeah, and for the secondary impression, maybe with the intraoral scanning, as I mentioned before, we cannot obtain a functional impression because we cannot register with an optical scan the movement of the tissue. So maybe if we want to maintain this data in the construction of the prosthesis, maybe we can use a conventional definitive impression, and after that we can scan, as we have shown in the very short presentation, and we are going to discuss in the next one. So for the functional activities, to date, the intraoral scanning is not the solution.
I have a question to everyone. How many time takes you feel comfortable with the digital work? Months or years? Alessandro? Alessandro?
Yes, I'm sorry. Can you repeat?
How many time you need to be comfortable with the digital work?
Month.
Maybe.
Month.
Month.
Yes. It's I like this system. I work on the digital system from 1 year, and in this year I like very this system because I have all the phase under control. Respect to the analogic system, I realize the phase in just a little bit of time. I can change the plane with only one click. For with this system, I can work with many time.
Okay, August, how many time you take to feel very comfortable with digital work?
The truth, I don't know, because I don't feel yet. But I think I start to feel fine after 6 months, no, half year to work. But you know, digital is something that is like everything. You know, you need to work every day, and you will feel better day by day. You know, but always have problems. For me, this is my experience. Always have problems with the computer, no? But it's okay. It's okay.
Alessio?
Yes, I think that the learning curve of the digital procedures is not easy, and it costs time and energy. I think for removable, I think more in laboratory than in clinic, in the clinical practice, because the majorities of the procedures in clinical practice are really close to the analogic world. So in the office, you need to register a closed mouth impression, but is something that we really well know from the past. So it's not a big changes. What I think is really interesting, and it is very important, is that we can communicate in a better way, because we can share from the computer the teeth arrangement, or we can see the patients together. And for us, it's not so easy, because we are working so far. And I think a part of the procedures in the laboratories, the communication is really improving our daily work really fast.
Thank you, Auguste. What is your best choice between printing, milling? What do you prefer?
Milling, of course. Milling is precision, absolutely. Sorry, I don't like too much print, you know, because you don't have a stability. Sometimes it's okay, sometimes it's not okay. Imagine a dentist that take a intraoral scan for me. I receive the intraoral scan. I design a crown inside my computer. I print a model. I take the crown. I take the model. I put the crown inside the model, and the crown don't work in the model. Don't have a good fit. Don't have a good contacts. And you think, well, okay, now I need touch the crown or touch the model. Better touch the model, because the crown is okay, because this intraoral scan is perfect. It have a lot of precision. The problem is the printing machine. Yeah, but I think we are in the way, you know, to have incredible printing machines. But just in the way. Today, the best is milling. Absolutely, milling. If you want an incredible model, incredible Geller model, alveolar model, please milling, because you will have one.
And for lithium disilicate, do you still press or just you mill?
This is a good question. This is a very good question. I like mill because it's fast. It's faster for me. But if I think about the fit, if I think about the opacity, I think it's better press. Yes, I love press. You know, I love press. The results from the press are perfect. But milling is faster, absolutely faster.
Thank you, Alessio and Alessandro. Is it possible to print removable denture?
In the current state of the art, the materials used for printing the bases and the teeth cannot match the milled one. In the future, I think that the printout will be able to equate to the milling.
Yes, I think that we agree with August about milling, because we have experience with the milling procedure, and we obtained a really nice result. About printing, we know that is on the way, but the validation also from the literature is not completed. So maybe it could be the future of the digitalization procedures in removable, but maybe we need to wait a little bit more.
Yes.
Thank you. Maybe we can have a short conclusion now. August first, on the perspectives in digital technology. If you had a dream,
you know, my dream is today. when I think about the past 20 years ago, and I think about today, this is my dream, my friend. It's incredible. It's something incredible. Yes. But I can imagine, I don't know, imagine one printing machine that can print static materials, but with natural structures, you know, with like enamel prisms or something like this, you know. This will be something nice, no? Because you will have the same internal structure, something like this. No?
It is your bioemulation sensitivity.
Exactly, exactly.
Alessandro, what would you like to say to a young colleague who is approaching the digital world in removable prosthetics?
The digital denture is, of course, the future, but studying is very important. As we have already said, the digital device proposes a solution, but it's the professional who decides which is the best solution to adapt, to fulfill the needs and the expectation of the patient. It's important to know the anatomy in order to proportion in the right way the reference point required by the device. If we give the wrong information, that the proposal of the device will be wrong. When we orient the occlusal plane, we must know that it passes at the half of the retromolar trigon. If not, we must fix it in order to achieve this result. If not, we must fix it in order to achieve this result. We can use both a singular assembling for each tooth and assembling each two teeth. We must be able to model the vestibular gum, so when the device proposes its solution, we can evaluate it and even choose to change it. This is a way having knowledge of the theory is important.
Thank you very much. And Alessio, how do you consider the future in digital metamorphosis?
Yes, I think that we were talking about new devices, intraoral scanning, printing, and I think that also software is changing so fast, and maybe in the next months, in the next years, we can have a lot of updating procedures. But I think that mainly we have to simplify our treatment, and we can do this approach with the digital protocols. I think that we need to plan our treatment to simplify and to manage the needs of our patients, because, for example, in removable prosthodontics, the aging of the populations maybe in future can change a little bit our patients in terms of compromised condition in their general health or their independency. So I think that the digital world can help us to improve this aspect in order to simplify and to obtain the best choice for our patients in terms of quality of life.
Thank you very much, Auguste. Thank you very much, Alessio and Alessandro. It is the end of the second session of the International Expert Symposium Ivoclar Vivadent. Any additional question will be answered and can be uploaded online in 24 hours. And I remind you that you can have access to on-demand webinar for the long version of these two presentations. Otherwise, we will meet again tomorrow for once more great presentations. Be ready at the same time. Bye-bye.
Thank you.
Bye-bye. Bye-bye.